Good afternoon and welcome. We are going to give it a couple minutes or so to let people join in before we kick off. While we wait, I'm going to drop a Q&A question into our chat to get everyone familiar with this feature. Would love to hear about any fun fall plans you have for the weekend. And my speakers, I know some of you are doing fun fall things. We got carving pumpkins. What else was everyone up to?
We're celebrating my daughter's 9th birthday on Saturday at Stokey Farm. So we're looking forward to that.
Very exciting.
Yeah.
No one else doing anything fun? We just all like laying low.
Pumpkin carving.
Yeah, you got pumpkin carving. And running a half marathon.
Yeah. That'll be next weekend.
Next weekend, though. Yep. That'll be exciting. I'm going to a bridal shower, so can't say it's too fall-oriented, but it'll be good. All right. So many people we got in here. All right, so we are just about a little over a minute, so we will get things kicked off. Thank you for joining our webinar today on improving the affordability of pharmacy care. We know many people count on prescriptions to stay healthy, and for businesses, that really means pharmacy benefits are a big part of taking care of their employees. And the challenge with this, of course, is they can also be a big driver of costs. So with that in mind, we want to make sure our employers and members are getting the most from their pharmacy benefits and are aware of everything that we have to offer. And so our goal for you listening today is that you learn something new about one of our programs or clinical teams and are able to pass that knowledge along. If you have questions during the presentation, please feel free to put them in that Q&A chat. If we have time at the end, we will try to answer any questions, but if not, we'll make sure we have a sales rep reach out to you. I am your host, Kristen Wuckelchuk, and I am a marketing manager on the pharmacy team. And today I am joined by our speakers, Amanda Wegman, who is a director of pharmacy strategic planning, Molly DeVries, who is a manager on our member care management specialist team, Amanda Slater-Hines, who is also a manager on our care management team, and Chris Deal, who is a director of pharmacy clinical programs and education experience. We are going to start things off today with Amanda Wegman speaking to the specific pharmacy programs we have available to help bring down pharmacy costs. From there, we will take a deeper look at the medical and pharmacy clinical teams that work together to provide integrated and coordinated care for members. And before I pass it off to Amanda, I wanted to highlight our mission to help people in our communities live healthier and more secure lives through access to high quality, affordable health care. It's what guides everything we do and every decision we make, including our approach to pharmacy benefits. So with that, I am now going to pass it off to Amanda to talk about our pharmacy solutions.
Thank you, Kristen. Hello, everyone. I am Amanda Wegman, the Director of Pharmacy Strategy here at Excellus. As Kristen mentioned, I will be covering the pharmacy solutions that improve affordability for our employer groups and members. I'd like to first make sure that everyone was aware that our pharmacy program offerings expand well beyond what you see on this slide. We have over 40 programs and formulary management strategies that aim to contain cost, but unfortunately, I don't have the time today, nor can I really imagine you want to sit through all that. So starting off with the backbone of our strategies is our utilization management programs. These will be included for our fully insured groups and optional for our claims-based bill groups. These 4 robust strategies all drive savings through the appropriate utilization of medications. With prior authorization, our clinical pharmacists and physicians review medication requests to make sure that the choice of drug or dose is appropriately prescribed based on FDA and manufacturer guidelines and clinical standards. So within our PI policies, we have a number of different strategies like advanced condition intervention and high cost, low clinical value that are critical in driving affordability. As we move on to step therapy, here we have edits in place where utilization is managed through a series of steps. So certain medications are not covered until one or more equivalent or typically less costly medication is tried first. Then we have quantity limits. It is exactly how it sounds. We have system edits in place to limit quantities to be sure prescriptions are in line with the FDA-approved dosage guidelines. And last, but certainly not least, is our biosimilar optimization. Much like a generic is to a brand drug, a biosimilar is a highly similar to its reference biologic. However, it is not identical due to its complexity. Biosimilars represent one of the biggest opportunities to improve access and affordability for our community. We include preferred biosimilars in all 10 drug categories in which biosimilars are available. Now we'll move on to Pharmacy Concierge, which applies to our fully insured groups and is optional buyout for our claims-based bill groups. Pharmacy Concierge is a retrospective utilization management support program that identifies prescription savings opportunities and provides recommendations on less costly treatment options through a peer-to-peer outreach. Our team of pharmacists and outreach coordinators works directly with the prescribing physician to review treatment options. The reason that this was all created was because the majority of our employer groups already had utilization management programs in place, like prior authorization and step therapy, and we were still finding savings opportunities that were identified after the fact. We know that there are only so many things that you can apply PA and step therapy to before there's provider abrasion, so this retrospective approach is critical to addressing those outliers. As you can see here, for our employer groups enrolled in Pharmacy Concierge in 2023, there was a combined savings of over $19 million with an average savings per conversion of over $3,100. So on the previous slide, you saw how successful the program was for our entire enrolled population. Here on this slide, you will see how one of our strategies, like a simple package size, has saved significant dollars for one of our large employer groups. Through Pharmacy Concierge, our team identified savings opportunity for members that were prescribed Cosentyx. Now, Cosentyx is a costly injection used to treat a handful of inflammatory conditions like plaque psoriasis or psoriatic arthritis, and is available in different package sizes. Now, many of our providers are not even aware of the cost differences when prescribing medications, which makes Pharmacy Concierge so valuable. Through the program, we identified the programs or the patients receiving Cosentyx and reached out to their provider to recommend switching the prescription to a 2-pack, as the cost of one syringe is the same as that 2-pack size. This simple switch saves on average $45,000 per conversion, and for this specific employer group that has been enrolled in the program for over 4 years now, has saved roughly $500,000 on this one strategy alone. Now, we all know that specialty drugs contribute a significant amount of spend for our groups on both the medical and pharmacy benefit. These next few slides will cover the programs that we offer to help drive affordability in this arena. When it comes to coordinating care for our members, our team really does it all. We coordinate everything from the identification of members, outreaching to these members, coordinating the transition from the facility to the home, getting the scripts from the doctors, all while ensuring scheduling is complete. Not only do we offer our members the option of switching from a hospital to a home infusion or a lower cost facility, we are also checking to see if there's a different formulation of that medication where the member can learn to self-inject instead of needing an IV altogether. The goal of the site of care program is to continually monitor our group's claims and look for opportunities to transition these members to a lower cost setting. This can generate impactful savings for our employer groups while offering a more convenient solution for the member. As you can see here on the right hand of the slide, one example of facilitating this transfer with a member has saved over $43,000 annually. Now, I did want to take a moment to remind everyone that we have rolled out a required version of the site of care program, meaning that if a lower cost option is available to the member, they are required to use that low cost setting. All of our insured business will be enrolled in the required version of the program as of January 1st of 2025, with our claims-based bill groups having this as an option. All right, moving on to SmartRx Assist. So SmartRx Assist is one of our newest programs that just became available for our self-funded groups on July 1st and aligns to our mission to drive affordability. I do want to note that this is only applicable to copay and hybrid plans, as high deductible health plans are not eligible. So this is a program that provides our self-funded groups with additional savings on medical specialty drugs that process under the medical benefit. These are specialty drugs that are typically administered as an IV infusion in an outpatient facility and are some of the most costly treatments impacting our employer group medical spend. So how does it work? SmartRx Assist identifies manufacturer assistance dollars in the market for select drugs and allows our employer groups and members to share in those savings. One highlight of this program that I always like to share is that it is administered in a way that there is no disruption to the member and eliminates their copay responsibility. Really a true win-win. Now, before I move off this slide, I did want to make sure that you are all aware that SmartRx Assist is going through a brand change. So in the next coming weeks, you will see that the program name is changing from SmartRx Assist to HelpScript. Next up is our Save On program. This again is only available to our self-funded groups. Similar to SmartRx Assist, Save On is a benefit that takes available manufacturer assistance dollars in the market and provides relief to our employer groups and our members. But for Save On, these are for drugs that process under the pharmacy benefit. Save On is an important lever to drive affordability as it provides financial relief to some of the most costly treatment options in the pharmacy space, ranging from oncology to cystic fibrosis. As you can see here on this slide, our self-funded employers have seen significant savings by participating in this benefit. Throughout 2024, our employer groups saved, on average, $543 per patient per month. Now, I also wanted to call out Save On Adapt, which is a version of the Save On program that is available to high deductible health plans. With Adapt, the Save On benefit does not kick in until the deductible is met. This benefit must be added at the start of the plan year as it needs to align with the member's accumulator. All right, now keeping up with the theme of specialty medications, we offer a unique and completely voluntary program that is available to our self-funded groups known as Medication Assurance Program. We all are aware that the specialty landscape is growing and growing at a rapid pace. Some of the drugs coming to market enter through what's called the FDA accelerated approval process. With accelerated approval, it can leave plan sponsors covering drugs that have not been fully proven to be clinically effective. And we have seen examples where accelerated approval drugs are covered for a number of years, only then to be pulled from market because they did not show that clinical benefit. With medication assurance, we monitor these accelerated approval drugs and hold our manufacturers to a financial guarantee that their drug will meet program requirements. For groups that elect a program, if a manufacturer does not agree to participate, their accelerated approval drug will not be covered. This helps provide an option for our self-funded employers to hold these manufacturers accountable that their accelerated approval drugs will be proven to be clinically effective. Now, the last solution I'm going to cover on today are our network options. These are available only to our self-funded groups as well. We offer 2 network options in addition to our broad network, first being our limited network. Through our limited network, employer groups can experience increased discounts through the participating pharmacies. This benefit typically generates up to 2% savings on prescription drug costs. Our limited network excludes CVS and Target pharmacies, all while maintaining over 43,000 pharmacies still in network. Another network option we have is our Smart 90 network. Much like our mandatory mail order benefit, the Smart 90 network requires long-term maintenance medications to be filled through either ESI home delivery or a major retail chain that is chosen by the group. CVS or Walgreens are the 2 retail options available for Smart 90. This unique plan design offers deeper discounts and increases medication adherence. So before I pass it over to Amanda, I did want to reiterate that we have many other, believe it or not, we have many other solutions and options available to our employer groups. With the time we had today, again, I want to reiterate that this was intended just for a high-level overview of the impactful ways that we can drive affordability in the pharmacy space. And now with all that, I will turn it over to Amanda to review our care management strategies.
Wonderful. Thank you, Amanda. Robust indeed. And I can only imagine what else you're hiding in your back pocket over there in pharmacy. Thank you so much for having me here today, Kristen. And I look forward to presenting our care management strategy in terms of working with our members in the pharmacy space. So first of all, I'll start with our model. It is an integrated, holistic approach to case management. We work very hard to engage our members across the board, regardless of employer group. Our clinical team is built of collaboration with pharmacy. We also have medical director support across the board. Registered dietitians who are a great value to us, and Molly is going to get into a deeper dive in terms of some things that they're working on in the specialty space, but we love that collaboration. We also work with our licensed social workers and other behavioral health clinicians in that space, like licensed mental health counselors, substance use professionals, et cetera. And then, of course, our very skilled registered nurse care managers with experience from home care, oncology, ED, cardiac, across the board. And we work to partner and pair our members with the right clinician to meet their healthcare goals. And part of our process in doing that is an assessment that really works to focus on condition-related issues, but also a medication reconciliation, which takes a look at the medications that they're on and looks for opportunities to help the member break through any barriers or concerns that they're having regarding that medication. So how it works in care management is we start with our referrals in to care management, which come from multiple places. Utilization management, so our partners in for medical necessity reviews, are one of our main sources of referrals, in addition to predictive modeling and rising risk stratification. When those referrals come into us, our supervisors triage them and assign them to the appropriate clinician based on their healthcare needs. We review with the member, again, like I said, condition, medication reconciliation, in addition to other areas of the assessment, and we develop a plan of care and work with the member to reach their healthcare goals. Part of the medication reconciliation process is taking a look at where are our opportunities for the member. Is it worth the exploration with our pod process and referring into the pharmacist of the day to see if maybe a 90-day refill would be more cost effective, or if there's a generic drug that might be more cost effective, or if mail order is appropriate. And again, we do not dictate treatment, but we make sure to explore any opportunities with the member that they may in fact be interested in and would be of a cost savings for the member, as well as potentially the health plan and the employer group. The benefits of bringing it all together is more affordable alternatives to current medications if members are having difficulty with payment. Converting, like I mentioned before, converting the prescriptions to a 90-day or mail orders are great examples of that. Our case managers can also onboard members to Wellframe for electronic medication reminders and education. Wellframe is our digital solution to communicating with our members through text if necessary, but we got, in addition to medication reminders, there's also education materials that could speak to side effects or other supports that might be useful for our members to understand as they're working through their healthcare goals. Case managers can outreach to members with newly diagnosed conditions, which is very important to our process. A lot of times members with newly diagnosed conditions are being started on new medications, and they're not necessarily anticipating any side effects or barriers to receiving the medications. So that pod relationship that we have with our pharmacist is critical at that point, because that's when we really can connect our member to the pharmacist, and they can have those conversations, and there's opportunities for the pharmacists and providers and case managers to collaborate together to work what's best for the member. We can offer proactive condition management in addition to that. So for example, we have a great team of registered dietitians, like I mentioned before. So in addition to somebody that maybe that's working on managing a newly diagnosed diabetes, we would potentially work with our registered dietitians as well as our pharmacy team to make sure that we're working on dietary needs to help manage the diabetes or even a cardiac diet, let's say. And that really could, in anticipation of maybe not necessarily needing to be on the medication long term once some of those other issues have been taken care of. Members with this carve-in benefit of pharmacy, 40% more engaged in care management programs than those with carve-out benefits. So we really get a lot of the folks that we work with really have a lot of questions about their medication management. So when we call them from a case management perspective, if they have questions or concerns regarding their medication, they're more likely to engage with us, and the more likely we are to be successful in helping them work through some of the barriers that they're having. So that's really, really important to understand. Additionally, carve-in members and care management programs save about 8% on allowed medical per member per month when compared to the members carve-out members that we can't help in this space, which can be a point of frustration for members when they call into the health plan and we can't necessarily see or have access to or have any insight into what's going on with their medications. And with that, I'm going to turn it over to my dear friend and colleague, Molly, to take a deeper dive into the specialty team and high-cost claimant.
Thanks, Amanda. You always tee me up so nicely, so thank you. Good afternoon, everyone. My name is Molly DeVries, and I'm the manager of the high-cost claimant team and specialty team. And I'm excited to share with you all the high-cost claimant approach to affordable pharmacy care. So high-cost claimants are members who exceed or are projected to exceed a certain threshold, $100,000 in expected costs in any given year. High-cost claimants can arise from acute situations, from poorly controlled chronic conditions that result in complex chronic advancing illness. The goal of the outreach is to provide the highest quality of care coupled with cost-effective treatment for these catastrophic diagnoses. This is achieved by utilizing dedicated multidisciplinary team consisting of and not limited to registered nurses, pharmacists, behavioral health professionals, social work, and medical directors to assist members in navigating the health system, as well as better controlling cost of care while improving health and quality outcomes. In addition, multiple specialties will co-consult on these cases that require specialization, such as registered dietitians, respiratory therapists, and physical therapists. So through this complete collaborative approach, it resulted in $4 million in medication cost savings and cost avoidance. So how does it work? High Cost Claimant Team meets twice a week along with concierge and HARP team for the High Cost Claimant Morning Huddle. This weekly huddle consists of a multidisciplinary group of clinicians, inclusive of medical directors, pharmacists that are dedicated to the High Cost Claimant team, utilization managers, and case managers. Additional support can be included, such as social work, registered dietitians, and behavioral health clinicians. Pharmacy role during huddle, they're responsible for reviewing pharmacy and medical claims data to provide cost-saving opportunities, identify pharmacy gaps in care, address adherence concerns, assess drug-to-drug interactions, send clinical progress notes, find opportunities for lower cost medications, and acknowledge when a member may need pharmacist support, such as inhaler use. From Morning Huddle, the pharmacist can recommend that a referral be made specifically to the high cost claimant pharmacist. After the pharmacist receives the referral from the care manager, the pharmacist performs a full medication therapy review, including looking up the member's specific pharmacy benefit and formulary, running a drug-to-drug interaction checker, and assessing for lower cost alternatives, gaps in care, and cost savings associated with 90-day supplies or mail order conversions. In addition, the pharmacist reviews any medical drugs for vial size optimization and dose rounding. The pharmacist engages with the member to address any medication-related concerns, including medication adherence, offers medication counseling, and completes additional outreaches to providers and pharmacies to ensure appropriate and optimized therapies. So here's a look at our pharmacy success story. A 53-year-old commercial member was trying to fill an expensive respiratory biologic medication for uncontrolled asthma. The pharmacy team noticed that the patient was filling their less expensive maintenance inhalers inconsistently, denied the medication, and referred this member to our high-cost claimant pharmacy case management team for outreach. Upon further review, the pharmacy and medical claims history, the member had multiple steroid taper fills between January and May and noticed nicotine dependence. The member stated the inconsistent inhaler fills were due to the presence of oral thrush caused by improper inhaler technique and an inpatient hospital stay for uncontrolled asthma. The member also expressed difficulty with stopping smoking and stated that they were ready to quit but tried multiple agents with no success. Our pharmacist counseled the member on the importance of inhaler adherence, correct inhaler technique, and proper oral care. Additionally, with significant coordination amongst the pharmacist, member, and provider, a new prescription was started to aid in smoking cessation. 3 months later, our pharmacist followed up with the member to assess their asthma control and smoking habits. The member successfully completed a 12-week course of smoking cessation medication and was able to cut back from 2 packs a day to 10 cigarettes a day. The member remained motivated with their quitting efforts and continued to wean with nicotine gum. The member also remained compliant with their maintenance inhaler regimen, has not missed any doses, and has not needed a course of steroid in over 3 months. This resulted in $3,600 a month savings in drug cost avoidance. And thank you so much. That is it from me. I'm going to pass it over to Chris to speak about our aquas.
Thank you, Molly. So my name is Chris Steele. I'm the Director of Clinical Pharmacy Programs and Experiential Education here at Excellus. And so to start, we're going to show a quick video, kind of giving a very high-level summary of what an aqua is. Okay, and so all that is great, but just to give you a little more detail on how it works. So what we do is we look at our members and we assign them to their primary care physician, and those physicians are part of these aqua arrangements. And so once a member enters into that arrangement, we then measure them for their quality performance as well as their healthcare expenditures for the year. And that's where that's at the point where pharmacy can get involved. So what our role in supporting these aquas is we work to provide actionable reporting to our aqua arrangements that really helps promote cost-effective prescribing and quality improvement. So we take our data, and that's one of our biggest values to our providers, and figure out ways to turn that data into action. So we identify specific opportunities, as I said in the video. Perhaps it's switching from more expensive drug A to less expensive drug B. Maybe members are on two drugs when they could be on one. Maybe they're taking two drugs and they don't need one of those two. But either we take that information, we share it with our aquas, and then the aquas are able to work with their primary care physicians to achieve the goals of controlling costs and improving quality. And that's really what we're trying to go for with this is collaboration. And we've found that this has been very effective because when we are asking them to work on something related to drug, we found more success when it becomes a peer-to-peer conversation rather than an insurance to provider conversation. And so, as you can see on here, we've had significant savings over the past few years, and that number continues to go up each year. Over the course of 3 to 4 years, we ended up saving about $36 million. When you look at the spend of our Aqua members versus non-Aqua members, the Aqua members are about $6.70 cheaper per prescription. So it really adds up, and that's a big part of what we do is we really like to work with our providers and help them achieve the goals that we're trying to do through Aqua. One of the other pieces that we're really focusing on is being proactive. So a lot of our work traditionally had been when you see someone on a prescription, provide that information, get them switched. We're now at the stage where we can start preventing those drugs from being prescribed in the first place, and that's really where we're focusing now. So for example, in the specialty space, we are really focusing on how to promote the use of biosimilars. So educating providers on what to write for, how to write it, which pharmacies are doing it, and giving them all the nuances and explanations that they may not have known otherwise lets us address the problem before it becomes one. So we're going to continue to be doing this work, but we really are very thankful to our providers and our provider partners because it's allowed us to achieve a lot of great things. And with that, I'm going to turn it back to Amanda Wegman to talk about what's coming in 2025. You're muted.
Amazing. Thanks, Chris.
Gotcha.
So yeah, wanted to share a couple of changes for 2025. First, impacting all of our groups, there is a new New York State mandate that eliminates the diabetic insulin copays. Obviously, knowing that there's financial burden put on these diabetic patients, we are in full support of this mandate. Moving down for small groups, there is a $0 tier 1 drugs for children. So new for 2025, tier 1 drugs for children up to the age of 19 will now be covered in full. And then if you would like any additional information about 2025 open enrollment, you can find that Excellus Sales Hub, or definitely talk to your account representative for more details. And I believe with that, I'll turn it back to Kristen to close out today's webinar.
Thank you so much. We don't have any questions that came through today, but before we wrap up, I am going to send out a quick poll about how you like today's webinar content and if there is anything you would like to hear more about in the future. So if you could take a minute just to fill that out for your feedback, that would be greatly appreciated. We'll be launching now. In the meantime, I'll check if we have any more questions that came through, but it doesn't look like we do. So with that, we will wrap up today. Thank you for joining our webinar. We hope you take something new away from our programs or clinical team capabilities. And thank you to our great panel of speakers for sharing all of your insight today. This recording will be getting shared out by email as well as added to our Excellus, BlueCross, BlueShield sales hub. If anyone from your team missed the webinar today but would have liked to listen, please feel free to share the recording with them. So with that, thank you again for joining and have a great rest of your day. Bye.
Thank you.